p.m. and I'd like to open the April 29th, 2021 school committee meeting. This meeting is being held virtually through Zoom. The town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants joined by phone do not see these conversations. Another concern is conversations between residents within the chat room which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you called in by phone, please use *6 to mute or unmute your phone. So that the meeting can occur in an orderly fashion, we ask the people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chair of the raised hands, and the chair will determine whether and when to allow public comment. When called upon, participants should unmute and state their name and address. After speaking, we request the participant return their microphone back to mute. All right, with that out of the way, we'll start with the consent agenda in the minutes from April 15th, 2021, and the oath to bills and payroll.
Make a motion to approve the minutes from April 15th, 2021, and oath to bills and payroll.
Second.
All right, the motion has been made and seconded. All our votes are roll call votes on Zoom, so I'll start with Timmerlin.
Timmerlin Rossius, yes.
Justin?
Justin McCarthy, yes.
Brad?
Brad Austin, yes.
Matt?
Matt Hunt, yes.
And Mike Fontella votes yes as well. All right, Lynn, I know it's raining out, and I love the raincoat, but do you want to take it off and stay a while? Or are you good?
I will. I turned on the camera. I'm like, I'm still wearing my jacket. I put it on when I went into Russell Street, and it just never came off.
The classic schoolhouse look. I like it. All right. All right. We have two sections in the meeting, at least, for input from interested citizens, one now and one closer to the end of the meeting. If there are any interested citizens that would like to speak before the school committee, please use the raise your hand function, and Dorothy Malone, our meeting moderator, will get you in front of us.
No raised hands, Mike.
Okay, I don't see any. Next, we have recognition. Dr. Clenchey, anything we want to go over tonight under recognition?
Sure, thank you. I'd like to thank Mrs. Steele and Ms. Snow for organizing an upcoming parent presentation on May 4th. It's a virtual presentation, topic, safe and healthy relationships. We're fortunate to have a strong partnership with Massachusetts Partnerships for Youth, and the presenter is provided by this organization. I'd really encourage parents, if they have that time free, to take part in this presentation. Lots of good information to take a look at. The presentation is geared more toward parents that have students in middle school and high school, but having had children myself, I wish I would have had that kind of presentation when my kids were in elementary school as well. Prepared myself for the middle school years, so to speak. They're going to focus on teen dating relationships, and how they identify signs of healthy and unhealthy relationships, strategies to deal effectively with jealousy, controlling behaviors. They're going to also talk about emotional and physical abuse, and also present some tools that can assist students when they end up in disclosure situations. So excited that we're able to bring this presentation to our parent community. And thanks again to Mrs. Steele and Mrs. Snow. I'd also like to say that I'm thrilled that we have most of our students back in grades K through 12, 5 days a week, full in person. Our staff and students have adjusted quite nicely to routines, and it certainly does resemble what we're all used to. But interesting how quickly people can adjust, and it's going really smooth. Everything that we thought about in terms of how we're going to serve meals, to mask breaks, to making sure that our rooms are organized in a fashion that we have consistent seating plans, et cetera, has worked out well. So special thanks to all of the staff that have been involved in making this happen. And that's it for recognition.
All right, thank you. All right, next on the presentations, we're going to start right with our state local public health metrics, and we have Katrina with us tonight.
Hi, everyone. All right, jump right in. Try to keep them, the lower we get, the quicker I can go, guys. So there's incentive to keep the metrics moving in the right direction. All right, so let's talk about those metrics. Here are the four main metrics for the state level. Just something to note before I present these, the state had a lower number of tests conducted over the last week, April break. And that was similar to February break and December break. We expect that kind of dip. We don't know if it's going to come back up or not. We'll have to see what happens over the next week or so. But so keep that in mind. But the cases have been declining actually over the last 2 weeks, and now we're at a 7-day average of 1,000 cases per day, which is actually a similar level that we had in October. The test positivity is 1.68, which is low, and been steady, which is great. Again, a similar level as to October. The last time I presented to you guys, hospitalizations were starting to creep up, and that was a concerning sign. But thankfully, they've been declining over the last week or so to an average of 640 per day. It's a level that was similar to mid-November. And on the very happy note, the 7-day average of confirmed deaths is low, as low as it was last summer, with about 9 a day. And that's the lowest we've been, post the spring surge of last year and before the new surge that we just have walked through. So this is a really nice sign to see that come down to that level. Hopefully it can keep going lower. And then another thing is that our vaccine supply has steadily increased across the state, and the number of people getting vaccinated in Massachusetts has increased steadily over the last 3 weeks or so. About 35% of Mass residents are fully vaccinated, and over 50% have had at least one dose, which is great. 56% of Middlesex County residents have had at least one dose. The other good things that are happening here in Massachusetts is that people who are getting Pfizer or Moderna, 99% of them are completing the 2 doses, so they get the higher boost for the more durable protection. And we also have very low vaccine hesitancy measures compared to other states. So we are really making some great progress in this area.
Hey, Katrina, when you say 35% are fully vaccinated, does that mean they've had the 2 shots or they've had the 2 shots plus 2 weeks?
The state defines that as having received their 2 shots, because they then assume in 2 weeks they'll be fully vaccinated. But yes, they're just measuring it by the number of doses administered. Good question. All right, so the other thing to keep in mind is that the things we want to keep in mind is we've prioritized vaccinations by different age groups, and so our rates are going to differ by age groups, and they have through this whole process. So here are the case rate trends by age group for the last 6 weeks. The good news is that for the last 2 weeks, we've seen a decline in all age groups. The rates remain highest among 15 to 19-year-olds, followed by 20 to 29-year-olds. These are the orange and red lines. And then follow that up with like those household clusters. So the 0 to 14-year-olds and the 30 to 59-year-old groups. Those purple lines at the bottom, these are my favorite lines. These are the people in the 70 to 79 age group and the 80 plus age groups who are prioritized first for those vaccinations. And their rates have been flat and at the same level since the middle of March, about 6 weeks after they became eligible to get vaccinations. And that's what we want to see for all of these age groups. So we're hoping that the other age groups trend down to these old people who we love and prioritized first. So these are another, again, we want this trend lines to keep going down. So we have to keep getting vaccinated to do that. So looking locally. Find my notes. Okay, so last week during vacation, we had this one glorious week in the yellow with 18 cases. And then this week we had 30 cases. So we're right back up and putting us back in that red zone. If we compare that to 2 weeks ago, and I always compare to 2 weeks ago because there's two distinct groups of people, so I can really compare which way the trends are going. We're actually very similar to where we were 2 weeks ago. So there's 28 cases 2 weeks ago, 30 this week. So we're holding, basically. I wouldn't be surprised if we find Littleton kind of hovering between the yellow and the red for a little bit of time here as we try to get people vaccinated. Okay, so this is the average daily incidence rate per 100,000 people for the last 14 days, so data through last Saturday. The rate in Littleton is 22 per 100,000, which again is similar to where we were 2 weeks ago. And the state, county, and all of those surrounding areas that we've been tracking have all trended lower over the last 2 week period. So we had a little bump up, but everywhere around us is going down. So let's hope we rejoin them next week. And similarly, our test positivity had a similar bump. So we had a bump up this week to 2.32%. Again, that's similar to where we were 2 weeks ago. So if you forget about last week where it was vacation and things were a little weird, we can probably just draw a line between the 2 weeks ago and now. So, and then all the areas that we track, the case rate and test positive, like the case rate, all the areas we track have been trending lower as well. So let's hope this is a 1 week bump and we continue to rejoin the areas around us. So I want to give this a little perspective though. We track, I've been doing these aggregated rates for 39 towns, plus the county, plus the state for months now. This week, there was only 4 towns that had a higher rate on this week's report, and all others had lower. So we are among the 4, unfortunately, that went the wrong direction. So the state statistics and our area statistics are really hopeful, but we really need to just take care and be careful and keep doing the right things for a little longer. So here is the health notification letters. I've been tracking cases over the vacations, which Dr. Clenchey provided me, which is awesome. So we had 3 cases reported to the schools over April break, which didn't need to have a health notification letter, but is in my graph. And then we received 1 health notification letter this week so far so we have 1 for this week. But again, we have had a little bump up and we're kind of holding at this point. And then when you split that out by school, the 1 case was in the high school. There was also a close contact. So keep an eye on those things. But again, we've been pretty quiet. We had our little flurry and then we kind of get quiet. So let's hope it stays calm. And in really great news for Littleton, our vaccination numbers look awesome. Like really, really hopeful. Really, I hope these continue a little bit longer. So this data comes from the weekly vaccination report by municipality, which was released today. 62% of Littleton's residents have received at least 1 dose, of which 38% are fully vaccinated. That's a slightly higher than the state level, which is amazing. The proportion of people who received 1 dose by age group is also very high across all age groups. And I know everyone's looking at that 0 to 19 group and it looks low, but that's not fair because only 16 to 19 in that age group are eligible for vaccinations. So one thing I have noted over social media and friends is the number of high school students who've been getting vaccinated over the last couple of weeks, and it's really encouraging. It's awesome to hear them. So when I looked at these numbers, we actually have 310 people in 16 to 19 who have gotten at least 1 vaccination in that age group. So that's awesome numbers for this age group, given that most of them aren't eligible. And that will really help protect our high school as they go about their activities and summer jobs, things like that. So that's really good. So I want to give a shout out to all of the high schoolers who sought out vaccinations over the last couple of weeks. And then just as a little, if anyone's competitive, females are outpacing males in terms of vaccinations. So if any males want to crush the females in the next couple of weeks, I highly suggest you go find some vaccine. So we're going to go back to the dour. Everything can't be rosy. The CDC updated the data for the variants that are circulating in our country, lineage as of April 10th. So this is the group right here. So as you can see, that B117, that UK variant, continues to grow. It's now around 60% in the US. It's also the most common variant here in Massachusetts. And the P1 variant. That's one that is concerning because it might escape some immunity. It's more transmissible. That's the one everyone knows from Brazil. It's about 7% of Massachusetts cases that have been tested, genetically sequenced, are the P1 variant. That's actually doubled since the prior 2-week report on March 27th when that group ended. So that's something to keep an eye on. And then Mass also has the B1427 and B1429 variants, those first identified in California, and that's about 3% of the ones. Those are the major ones circulating right now, although there are some others. So the bottom line that you guys need to know is that the variants are here. They make up a majority of circulating COVID cases in our state. Many of them are more transmissible. Some of them confer more severe disease and may evade some of our immunity, natural immunity or vaccine-acquired immunity. So this is important to continue to do what we can to slow the spread so we can get everyone vaccinated and drive those rates down. It is important to note that the current 3 vaccines that we have accessible to us do remain to work in these 3 circulating variants that I just talked about. So the good news is our vaccines are well matched to the variants circulating in our state. We'll just do our little public health reminders at the end here. So not only do we have these more transmissible variants circulating in Massachusetts, but our webs of connections with schools opening, businesses coming back open, everything is opened wider than we have been for the last year. And it's kind of easy to forget how connected we are. So we are all part of this connected ecosystem. So what impacts one person will impact others. We've been talking about this for months and about all those layers of cheese that keep our families and our communities and ourselves safe, and have actually helped to keep our town rates our metrics really good. So we just need to keep doing those same layers of protection as we move forward, so that we can get through the school year without incident, and then also set ourselves up for a really much safer and open summer. So the big news this week was there's multiple mask updates, and some of them kind of conflicted with each other. It was a little confusing even to me. So by now everyone's aware that we have these changes coming at us and are excited about them, which is awesome, because if the more people we get vaccinated, the lower those rates go, the more we should be having changes to the things we can do and masking and things like that. So the state announced that the update to the mask order will go into effect tomorrow, and that individuals will be able to go on walks and runs and bikes and do other socially distant activities outside without a mask. The governor did make it very clear that masks will still be required in some outdoor settings and all indoor settings as outlined in those sector-specific safety guidelines. So things like youth sports, even spectators will need to wear masks in those situations. If you're going to the library book sale this weekend, you'll have to wear your mask if you're shopping at the book sale. Prom would be another thing that falls under those outdoor events. Those still have the mask mandate attached to them as far as I'm aware. So basically, if you do anything in a group, the mask will still be required. The basis of these changes are actually really twofold. One, we're rewarding ourselves for getting vaccinated and having this really good vaccination coverage. We want to keep making changes as more people get vaccinated and our rates go down. And then 2, the science is pretty clear that it's really hard to transmit COVID out in outdoor environments. That's why we keep talking about making the indoors like outdoors at school, eating lunches outside, things like that. So the outdoor is a great place to start with these, making these changes. So I do want to just acknowledge that things are going to start getting weird over the next few weeks. We're going to have some states roll back some stuff and other states do other things, and the CDC will say something else. And it's going to get a little confusing because each state will do something different based on their vaccination coverage and also their metrics. So many of us are in the situation where our family members, like our kids, are not vaccinated, but the adults may be vaccinated. And if we're gathering with other people, then they might have different risk factors or risk tolerance, and it might be a little hard to negotiate. So think of it like a safe sex talk. You just gotta have the conversation about how you want to handle every gathering. And I don't know about you, but I'm having trouble keeping these new guidelines straight. So the simplest way that I could boil it down, and others have also done this, is to remember the 2/3 rule. So we can continue to slow the spread if we do at least two of these three things when we're around other people outside of our household. If we're either distanced, we wear a mask, or we are outdoors. So if you are hanging out in your backyard with friends and you can keep distant, then you can not wear your mask, kind of thing. And then vaccinated people have more flexibility in using these tools. And I would actually encourage you to choose the outdoor option as much as you can when you're around other people, just because it is much safer. Masks are still going to be required for everyone in crowded outdoor settings when distancing will not be possible, or when those sector specific guidances require them. So it's just best to throw one in your pocket if you're heading out on a walk, just in case you find yourself chatting close to a neighbor. And it really comes down to, if you have to ask if you need to wear a mask, then you should just wear the mask. And like I said before, communication about vaccination status and risk tolerance will be key as we start to like hang out with friends and things like that. And I'm going to end on the most critical thing we can do to help protect ourselves and our community, and that is to get vaccinated. So the more and more people are vaccinated, the lower the rates will go down, and then masking and these distancing requirements will start to be peeled away and relaxed. The governor laid out a plan to start opening more businesses, with a plan to remove those reopening guidelines by April 1st if the metrics stay where they are or improve. So everyone age 16 and older is now eligible to get a vaccine. And the vaccine supply has actually increased a lot. It's not as hard to find anymore. So I even saw today, or actually when I went to get my vaccination yesterday, Marlborough has a walk-in clinic at the Marriott that you can walk in without an appointment. So there, and the Littleton's CVS is now giving out vaccines. So it's in our area, and it's much more accessible than it has been even 2 weeks ago. So again, getting vaccinated is the most effective layer of cheese that we have to protect ourselves and to reduce transmission. And so there are lots of benefits to vaccination. And one is that the immunity you build through vaccination is actually stronger than that with natural disease. So natural infection that you might have acquired over the last year. Plus it comes without the risk of severe outcomes or long-term health effects. So also vaccines are how we're going to get ourselves back to normal, so we can start interacting much more normally. So if you haven't made your appointment yet, I really encourage you to go try to seek one out. It should be pretty easy these days. And if you don't, ask others who have gotten vaccinated to see if they have any hints of how to get an appointment. And then one thing is that there's a lot of vaccine misinformation being circulated these days, a lot. And I know it really has made some people uneasy and uncertain, and it's adding to some hesitancy, and I completely understand that. So what I do want to encourage everyone to do is, if you do have questions, to reach out to your doctor and ask them. Your doctor is uniquely situated to know your medical health history and to help you discuss the benefits and risks with each of the types of vaccinations that are available, and to help you make an informed decision about whether to be vaccinated or not, and with which one. So I really hope that reaching out to your doctor would help you make that decision, whichever way is best for your health. But your doctor is your key teammate right now to helping navigate those waters. And if we can get as many people as possible on team vaccinated, then things will get back to normal much sooner. So go team vaccinated.
All right, thank you, Katrina. I believe Lynn Snow is going to give us an update on close contact definitions, because that's changed a little bit too. But before we do that, does anybody have any questions or comments on the material that Katrina just went over? Brett?
Yeah, actually, I had a question about the close contact, so I'm so glad Lynn's will explain that. I just want to thank Katrina for that. But if I saw that slide correctly, 2 of our 5 total close contact identifications of the course school year have happened since we've been in the more fully reopened status, I guess. Is that correct? Like 2 of them come in the last 4 or 5 weeks?
Yeah, there was one at the middle school and one at the high school who had a close contact.
Right.
Since they reopened to full 5-day.
All right. Thank you.
You're welcome.
All right, Lynn, do you have an update for us?
I do. Oh, thank you. And just before I start, to piggyback on what Katrina said regarding the vaccinations, it's also important to know that females are more resistant to infections. So it's that much more important for men to get the vaccine. And there's been a lot of research that if men get COVID, you're going to have a more severe case. So there's my PSA. So just to continue on looking at some of the updated definitions and guidance, I'll just review the 3-foot distancing. So while school districts, DESE has provided the guidance that districts should space students more than 3 feet apart when feasible, the evidence does demonstrate that when that the additional risk reduction associated with 6 feet as opposed to 3 feet is low. So when masks are worn and other mitigation strategies are in place, DESE's approach to physical distancing was endorsed last summer by the Governor's COVID Command Medical Advisory Board, the Massachusetts chapter of the American Academy of Pediatrics, and medical experts from Mass General. So since then, DESE's approach has been further endorsed and validated with numerous groups noting the safety of 3-foot distancing in classrooms standard and supporting the return of students to full-time. So just to continue to move on, the update on the quarantine guidance for close contacts. The easiest way, I think, to kind of think about it is in terms of categories. So we're going to have quarantine and non-quarantine close contacts. So so thinking in terms of what's happening in school in class and in school out of class. So close contacts who were exposed to COVID-19, to a COVID-19 positive individual in the classroom or on a bus while both individuals were masked do not have to quarantine unless they were within 3 feet of distance of the COVID positive individual for a cumulative total of 15 minutes during a 24-hour period. So this does not apply if someone was identified as a close contact outside of the classroom or the bus. So for example, sports, extracurriculars, lunch, or if masks are not worn by both persons at the time of the exposure. So all other close contacts must follow the standard protocol for when a close contact may return to school. So it's important to know that the school is going to notify all close contacts that have occurred in the school setting, and parents will be provided further guidance. So helping them. So don't think that this is the only the only time you're going to get this explanation, because like Katrina said, it is going to be a little bit confusing. Like, wait a second. So were we a quarantine close contact or a non-quarantine? Do we have to? There's also the added layer of, well, vaccinated or not vaccinated. So we'll just kind of continue on. So just as a reminder, the Department of Public Health continues to define close contact as being within 6 feet of a COVID case, someone who is tested positive for a total of 15 minutes during a 24-hour period. Multiple brief or transitory interactions less than a minute. So, passing in the class, walking by a desk in the classroom or walking up and down a hallway throughout the day are unlikely to result in 15 minutes of cumulative contact and don't meet the definition of close contact. We will make those definitions for you, though, so you don't have to worry. That the nurses, in collaboration with the local board of health, will do that legwork for us. So being in the same room as an individual, if you're consistently separated by 6 feet of distance, does not meet the definition of close contact. A close contact can occur when being with, caring for, living with, visiting, or sharing a healthcare or waiting room area with somebody with COVID-19, or having direct physical contact with the person, hugging, kissing, or sharing eating or drinking utensils, or having direct contact with infectious secretions of COVID-19. So, for example, being coughed on while not wearing recommended personal protective equipment. So just to reiterate, again, all close contacts identified in the school setting are going to be notified, and you will be provided further guidance. So close contacts who were exposed to a COVID-19 positive individual in the classroom or on the bus, while both individuals were masked, they don't have to quarantine unless they're within 3 foot of distance of the COVID-19 positive individual. And so when we say all other close contacts must follow the standard protocol for when a close contact may return to school, if there's a close contact and you're within 6 feet, I would say err on the side of caution that's up to you. The guidance specifically says individuals should test. You're not technically required to, but you would be required to quarantine if you are a 0 foot close contact or a 3 foot close contact. And so then just to continue on, individuals who are fully vaccinated or who have confirmed COVID-19 in the last 90 days also do not need to quarantine as long as they don't have symptoms. And so exiting quarantine, I think this is helpful to share again. When individuals exit quarantine, masking and other safety measures remain critical. It may be best for individuals who are not able to adhere to masking and distancing to exit quarantine after 10 or 14 days rather than the 7-day quarantine. In addition to symptom monitoring, individuals exiting quarantine prior to 14 days must also take their temperature once daily. Even if mild symptoms develop, or if the individual has a temperature of 100 or above, they must immediately self-isolate and contact public health, who is overseeing their quarantine, and be tested. And so self-isolation for COVID-19 positive cases is a minimum of 10 days. It's important to know that transmission may occur from persons with COVID-19 who are symptomatic and those without symptoms. The duration of infectivity is defined as 2 days prior to symptom onset or 2 days prior to a positive test if asymptomatic, through 10 days after symptom onset, and is contingent on meeting clearance from isolation as defined by being gone for 24 hours without a fever, 10 days and gone for 24 hours without a fever and without taking any fever reducing medication, experienced an improvement in all of other symptoms, and having received clearance. And so repeat testing prior to return is not recommended, and the return to school should be based on time and symptom resolution. And it's also important just as to know too, day 0 is the first day of symptoms or the day of the positive COVID test if asymptomatic, and exit from self-isolation is on day 11. So that's the general update.
All right, thank you. Any questions or comments for Lynn on any of that?
Sorry, Lynn, it's just the same question I had earlier for Katrina. I wonder how the state's defining fully vaccinated. Is it second shot, you don't have to quarantine unless you're showing symptoms?
So we, DESE, the district's fully vaccinated is 14 days following your second shot.
Gotcha, thank you.
Yeah, you're vaccinated. You're half vaccinated after your first shot. If you're a 2-shot vaccination, you're vaccinated after your second shot. So you're not considered vaccinated after shot 1. You're considered vaccinated after shot 2, unless you take the Johnson & Johnson, which is back on the scene. And then you're fully vaccinated 14 days post second shot.
Thank you.
So day 15, you would be considered would be considered fully vaccinated.
All right, Justin?
Yeah, thanks very much for all the information. So I guess my question is, when I first saw this information, I was like, ooh, DESE's getting a little aggressive with the distancing here. I didn't necessarily disagree with it, but they were certainly making a stand. And then Katrina, I saw your post today in response to Wendy's question, and I appreciated your insight there as it relates to transmissibility. So I guess my question is, do we think we're putting our students in a situation where they're 0 to 3 feet for greater than 15 minutes? Because I don't necessarily think that's the case. And then are we ever in a situation where we're less than 6 feet without a mask? Because the way that I foresee the day is that there's very little opportunity for close contacts per the DESE updated guidelines. If I can get a confirmation or sort of a statement or clarification on that.
So a quarantine close contact. A close contact.
Correct.
There's a
That's what I mean. Yes, that's what I mean. Yep.
Mm-hmm. Yep. So there's difference. So, I mean, do we have students who are working on mask toleration? For sure. Are they working closely during certain therapies? some students with significant disabilities, and they are within that 0 to 3 feet. Yes, but we are, aware, and the staff are using higher level PPE. Our hope is that they're vaccinated. So we have all of the mitigation strategies that have always been in place to protect staff in those circumstances. But no, the students are sitting 6 feet away during lunches, and they in the classroom. So that's why the other piece, when I said we need to think in terms of in class, in school, and in school out of class, because when I said it doesn't apply if someone was identified as a close contact outside of the classroom or bus. So if you get a call and a child is defined as a close contact, there's different criteria. So they could be a close contact required to quarantine if that's during sports, extracurriculars, etc.
Good. That's entirely helpful. I was just kind of making sure that that we believe that sort of under all normal circumstances, we're going to sort of be outside that quarantine close contact definition. I understand, of course, there are extenuating circumstances, and then I don't believe anything's changed with the staff level, right? That like adults in the building are supposed to maintain 6 feet at all times. I don't think that updated, correct?
No, when possible and when feasible, for sure. Yeah, and so the other thing is just the reason for this change is the spirit of it behind it, I believe, is that, our schools are a more controlled environment.
Perfect, thanks.
All right, thank you. Anybody else? All right, then we'll move on to the next agenda item, which is an update on the high school sewer discharge site project. So we are posted for a joint meeting with the Littleton Water Department commissioners on May 5th, which is next week. I think that's Wednesday, right? Yeah, on Wednesday. We have communicated to them that our preference as a school administration and a school committee is that we, the water department, really strive to start this project after the fall 2021 athletic season. And we communicated to them two primary reasons why we really want that to happen, and are basically insisting that it do happen then that way, unless there is significant, demonstrable, and measurable reasons why it can't. The first reason is that, after hearing from the administration and Mike Lynn, we really feel that disrupting the interscholastic athletic season for our athletes who have already gone through 2 seasons of crazy disruption is really unfair. And if we can avoid that in any way, then we're going to do everything we can to avoid that. The second thing that does is it buys us more time in terms of going out to bid, so that we can ask the water department to go out to bid initially with the asking for the bid package to include synthetic turf as the choice of replacement for the playing surface. This allows us to get definitive bid amounts so that as a community and as a school committee and as the rest of the town government can make a determination about, can that fit into the existing budget for this project? And if it doesn't, how far over are we? And is there a way to feasibly pay for it beyond what's already been authorized for spending on this project? If the answer is no, then we will go back out to bid for sod or hydroseed, probably sod. But even if we can afford it and we find a way to do it, that still would allow us to continue to debate as a community, as a school committee, whether or not that's what we want to do, even if it is cost effective. Even if we get the bid back and the dollars look like we can manage it, we may make a decision for other reasons not to pursue that. And again, would let the water department know, nope, we need to go out to bid again because this package isn't sufficient to the purpose for whatever reason. Go out to bid again with non-synthetic or natural playing surface as the replacement surface. So that was communicated to the water department and Nick Lawler and the commissioners. That will be the gist of the discussion at this joint meeting next Wednesday. I'm hopeful that we'll be able to get some solid information on if that's achievable, if that timeline of starting after the fall 2021 season will work for them. Their biggest concern, as I understand it, and they'll certainly get an opportunity next Wednesday to explain this in more detail to us, is that there are two primary funding sources for this project. One is $1 million from town funds that were allocated via a town meeting vote. The other is a $1.5 million grant from the state. That grant money needs to be spent by the end of the current fiscal year, so that's June 30th of 2022. So they know that if they started the project in the fall of 2021, that they would be able to spend the money by the spring of 2022, no problem. But if they start later than that, then they're a little more concerned about their ability to spend that money. But they didn't say they couldn't. It's just not going to be as easy. So I've asked them to take a good look at that and make sure they can explain to us how feasible that is. And I expect a good meeting next Wednesday, and I think it'll be informative and should set for us a path forward for understanding the timeline better and understanding our options relative to that timeline. Any questions or comments about that? All right, Justin?
Yeah, thanks for the update. So I think I wanted to sort of just reiterate that we heard from the certain aspects of the community in the past couple of weeks on this topic. And it seemed like those that have a need for field usage are certainly in favor of athletic turf just due to its playability. But then we also heard from some other members of the community related to possible environmental concerns related to an additional athletic astroturf facility in town, which was the primary concerns were, well, I guess my first question is the last time we went through this, there was sort of a community outcry or need for information related to the tire crumb in the infield. Mike, maybe you can real quickly let me know what we decided or how we avoided that situation last time.
So good point.
What did we end up?
Last time, right, we went through a exhaustive process for evaluating we knew we weren't going to use recycled rubber, any type of recycled rubber material. The town meeting had put a temporary moratorium on the use of that. We evaluated, I want to say like 5 or 6 different fill materials, and they varied in terms of expense and type of playability, length of use, things like that. I honestly don't remember exactly what we chose, but I did have a conversation with Mike Lynn as part of this, working through this project. And he stated unequivocally that was the best decision we made, that using a virgin non-recycled material was absolutely the right way to go, and that he would fully expect to do that again. And he particularly liked all the materials that we evaluated were non-recyclable. They were virgin materials, but the one we picked, he wants to use again. He said it's a perfect blend of resiliency and playability, and shifting between football, soccer, lacrosse, field hockey, everybody seems pretty happy. If we knew we were only doing a field hockey surface, we might make a different decision. If we knew we were only doing a lacrosse facility, we might make a different decision. But he said the fact that it's going to be a mixed use, all of our fields will always be mixed uses. We don't have that luxury. He said that the material we used was the right one, and he would advocate strongly to use it again, both because it's non-recyclable, virgin material, but meets everybody's playability requirements quite well. So I think that is the direction clearly that he wants to pursue, and I would expect that we would pursue it in that same manner. Now, that comes with a cost. That was definitely more expensive than using a recycled material, but we made it work at Alumni, and my assumption is that we would make it work here. And if we couldn't because of the cost perspective, then it would just be, we wouldn't do it, right? We'd go to a natural playing surface. So that's where we're at with that.
Okay. Yeah. So that's good to hear. It sounds like we got that right the first time. Having been on that field myself, I mean, you take that stuff home with you. Like as you walk through your front door, those rubber pellets are just, they made the trip home with you. So they're everywhere. But so what we heard this week or the last couple of weeks was sort of the PFAS, which is sort of a hot topic in Littleton, of course, with the information going out from the water department. So as it relates to the manufacturing of the grass blades. So that's something that obviously I think we'd want more information on or get a comfort level with. And then ultimately the disposal of the field. I think that probably takes care of itself because there's a lot of athletic artificial turfs in the country at this point in time, and they're all going to need to be disposed of at some point in time. So I think there's an opportunity there for somebody to try to figure that out. But it was the tire crumb or the rubber pellets and the PFAS issue. And then of course, how are we going to pay for it? So those are sort of the 2 or 3 hot buttons that I'm going to need information on as we get ready to make a decision on this topic. That's sort of all I wanted to share.
Okay. Steve Mark?
Yeah, just to clarify, the product that's on the current athletic field is called EPDM. I forgot what the long 100-character word stands for, but it's called EPDM. People can research it, and it is all fully recyclable. So at the end of its lifespan, that product is recyclable. Just wanted to make that point.
Right. That's the fill. Right. The carpet itself, there are issues around the recyclability of that particular material. So, okay. Anybody else? Brad?
Yeah, I just wanted to be clear. So we've called a joint meeting on the 5th to get a better sense about what a potential timeline might be. But there's been no decisions. There's no fait accompli. We'll maybe see if it may be possible because of timelines to push it back, and then maybe see if it may be possible to consider a turf field. But no decision's been made, and frankly, a future iteration of school committees can be the one that has to make the decision.
That is definitely true.
Yeah. Right.
That no decision will be able to be made prior to the election. So it'll be the next school committee's.
Yes, I just wanted to
run
be clear.
with.
We're talking about, if this could happen, if it could work. That's all ifs, and the biggest if is if the school committee votes to make it go that way.
Right.
So I just want to be clear. It's all contingent on a future discussion and vote where the town's fully involved. All right. Thanks, Mike.
Yep. All right. All right. Next on the agenda is a consideration of school choice slots for the next school year. Dr. Clinchey?
Thank you, Mike. I believe the slide's coming up pretty soon. There we go. So as per statute, every year the school committee has to vote on the number of open school choice seats per grade. We've created a table that should provide you with hopefully all the information that you need to understand what we're proposing. I'm sure, as you're all aware, it's a prediction. The opportunity to capture school choice students is far greater in the early grades than it is as we go through our district right through grade 12. It begins to drop off at Russell Street, further drop off at middle school, and again at the high school. So the seats we're proposing tonight by no way means that those are the number of seats that are going to be filled next year. The first column on the chart refers to the various grade levels. Second column, projected student residents that we have currently. And the third column is the school choice students that we currently have. And fourth column is what we're projecting, what we're recommending more correctly for the 20.
Kelly, can I interrupt for 1 second? I'm sorry. Maybe it's just me. I'm having a tough time seeing this whole screen. Is it just me?
I'm actually having trouble too, and I'm glad I have another computer by my side with a slide.
Okay,
So
I don't. Is there
you can, let me see here. If you go to 50%, Brad,
yeah, I'm too old to see it at 50%, Kelly.
I
That's
tried
fine.
enlarging it. Did that help?
I'll just sit uncomfortably close. No problem. Go ahead. I'm sorry to interrupt.
okay, are you sure?
Yeah, sure. It's fine.
Okay. So the fourth column refers to the seats that we're recommending that we open. The fifth column would be the total number of school choice seats if the new seats were filled, plus the ones that we currently have at each grade level. And the last column would be the projected number of students for the 2021-2022 year. Please remember that we do not anticipate filling a number of these seats. As I stated earlier, the greatest opportunity to capture students in our school district or any school district that offers school choice is really in the younger grades. There are a few exceptions. For example, we do have community members that move to other communities and would like to have their children stay in our school district, and they would apply for school choice in order to do so. We do have parents from other communities that end up working in Littleton, and out of convenience and the reputation of their school system, they would prefer to have their children in our school district. So those are some of the drivers as we take a look at the history of school choice in our district. Kindergarten is always the hardest to predict. Naturally, families that have children that are preschool age make decisions when their children get closer to school age as to where they would like their students to attend, their children to attend school. So that results in at times families selling their houses and moving to communities where they want to see their children educated K through 12. So having said that, if I go down the table, starting with kindergarten, we currently have 105 students registered. That can change. We try to track as many students as we can in our community that are eligible for kindergarten. We've contacted everybody that we know, and we still have some people that have either said no or undecided. The undecided ones are not captured in that 105 projected student enrollment. So, but we can only go on what we have. So we're recommending, and we typically recommend 5 open seats in kindergarten each year. The whole concept or idea behind that is if possible, and we don't, it depends on the grade exiting, our seniors, how many school choice students we have. We have 7 students currently in grade 12 that will be graduating this year. But I'm a little hesitant to go beyond 5 because of the difficulty in predicting move-ins, etc. It's still pretty early. So that would, with the information that I've given you tonight, that kindergarten class would grade more correctly would have 110 students. We look at grade 1, we currently have 99 students. We also have 5 school choice students. We're recommending to open up 6 seats, which will give us a total of 11 if they were all filled, and a total population of students in grade 1 of 110. I don't know if you'd like me to go through the whole thing. I just wanted to make sure that you understood the flow of the table. I can certainly go through a few more. Grade 2, we currently have 112 students. 2 school choice students are currently in that class. We're recommending that we open up 5 more seats. If they were filled, we would have a total of 7 school choice students in that grade next year and a population of 119 students. Russell Street, we go through the same pattern. We're recommending 5 new seats in grade 3.
Kelly?
Yeah.
Can I sort of just jump in here and ask a question? So maybe it would make sense. I don't know. I'm thinking maybe it would make sense to take it one school at a time.
Sure.
So this is obviously an important topic here. It's sort of a fine line between trying to keep optimal class size small for our residents, and then at the same time making sure that we sort of, I guess, maybe I don't know, advertise is the right word, an open seat or open seats in a grade level to make sure that we are sort of providing the best bang for our buck. At the same time for our taxpayers, because we can get some additional revenue here with some school choice dollars. So if I look at Shaker Lane, is 110 students the right number per grade level, which I think is about 22 students per class? And we just happen to have 9 extra students in second grade because there's a little bit of a bubble there? Or am I not looking at this the right way?
Actually, it's a little different in terms of we have 6 teachers in each grade, 6 kindergarten teachers as well, and 1 transition teacher, and so there'd be 7, 6.5, I guess, if we split them 50-50, but that never works that way. So let's focus on grade 1 with 6 teachers with 110 students. Your class size would be 18.3, so 18 students. So we obviously want to make sure that our class sizes are conducive to learning. We would never jeopardize that at all, but there are anomalies, Justin, that happen in every district where all of a sudden you have people move into a town or a district, and there's a concentration of students in one grade. And those are things you can't predict, but in those cases, we take a look at the number of students we have in each classroom, and if necessary, we hire another teacher to take care of that bubble, so to speak. We've been pretty good at doing this. We've been doing it for a lot of years, and but again, I can't say with certainty that we won't end up with a bubble. We do. I mean, that's just the way it happens in any community. But we've never been put in a situation where we haven't been able to figure it out. And we've always been fine with the class sizes in terms of them being at a level that we feel offers great educational opportunities for our students.
Okay, that's helpful. Sorry, my teacher count was wrong. So yeah, 18.3 is better than 22. So help me understand first grade, second grade, right? So in first grade, we're hoping for 110 kids. But in second grade, we're comfortable offering another extra 5 seats to get to 119. Why wouldn't we offer another 9 seats for first grade and get to 119 as well?
Because if you take too much of a risk, it's going to backfire. Those are the grades where we would see the most move-ins in typical years. Okay,
so you have some historical data or some sort of some gut feeling that sort of the 99 registrations in first grade right now is probably going to increase before we have the start of the school year. So we might end up closer to 119 anyways.
Well, I'm glad you asked that, because it's kind of funny in a way. My prediction came true today. We have 8 new students that are moving in and registering their students or children more correctly in first grade.
Kelly, I'm just throwing you softballs all night long. So,
Kelly, I have a related question to that, and Justin, you're asking a lot of my questions, and I appreciate that. But Kelly, I'm wondering if we have a sense of whether this last year, there more parents than usual, more families than usual, put their kids in private parochial school or homeschool in order to not have to deal with the hybrid remote model, and maybe returning or entering our school system. If there are numbers out there, bubbles out there that we may not know about, or maybe we do know about, that could influence these numbers.
Well, we did know about them, and we've done what we can to contact those people. And we have, depending on the grade, we have some pretty good ideas of whether they're coming back or not. And during the year, we actually started out with more people that had decided to take an alternate educational route, and then throughout the year, some of them started to come back into our schools as well. So there is a little more unpredictability, Brad, this year than previous years, which makes sense, common sense. But having said that, I think we have a pretty good idea or handle on our grades and the potential numbers that may come back. For example, Brad, in grade 3, we have 107 currently enrolled. if we took into account families that offered alternate school or took part in alternate school or educational opportunities, there's only 2 more students, 109. So we're doing pretty good. So we've been as methodical as we can be without having people sign on the dotted line if they're not ready to.
Right. Well, thank you for that. And I'm looking at the totals, and to kind of get to your and Justin's conversation earlier. It looks like grade 4 and grade 7 are some of those kind of natural bubbles where they can, there's an extra, 15 or so kids in that grade level, just randomness.
Yeah. But you have to remember that from grade 6 to grade 7, we have some students that leave to attend Parker. So typically that's between 8 and 9 students. In grade 8, we have students that choose to go to Neshoba Tech. That's anywhere between 8 and 10 students. So let's look at this from a single grade going through our school district. And let's suppose, and this may or may not happen, that the grade enrollment remains static until they hit grade 6. So from grade 6 to 7, we would most likely lose 8 or 9 students. And if that grade continues to grade 8 and it's static still, we would then lose another additional 8 to 10 students. So we're close to 18 to 20 students that we've lost if that grade remains static since it started in kindergarten. And then we have a high school to make sure that we have enough students to offer a full complement of courses. So it's a little tricky at times, but we've been very successful at making this work. I just wanted to point that out because that happens in any community that has pivotal points where families make decisions about what school their children will attend to continue their education.
That's helpful. Thank you. And this presentation's been really helpful for me. I appreciate it.
Excuse me, Kelly. I just have one question. Are we working with all the development that's going on in town, these bigger projects? Do we have someone who's working with the planning board who is watching how many houses that could possibly in the future, like not next year, but in the next 5 years, be built in our town?
Yeah, we've been monitoring that for years, and Mike can attest to this. Our enrollment hasn't been affected that significantly with the new housing developments, more correctly, in town. We're always watching that. Again, families are really good about checking schools out before they buy houses in town. And we're really good about communicating with future families, and most often if they have school age children, they send us their bill of, or I'm thinking of the right acronym, PNS, purchase agreement, before they even move into the house or before the house is built. So we've been good at or more successful than we thought with developing a process that allows us to keep on top of things as much as we can.
Yeah, we need to be careful. There is definitely, it has been proven over the last decade that there is not a direct correlation between housing growth and student enrollment. It does not correlate directly. There is some enrollment growth occurring, but you can't attribute it directly to new housing growth. You can attribute it to things like, do we have a good school system? Do people want to live in Littleton for other reasons? Can they afford to live in Littleton? All those things are more predictive of student enrollment, the level of student enrollment. I won't even call it growth, because the demographic trends are that there are going to be fewer school-age children available for enrollment in the Commonwealth of Massachusetts for the next 10 to 15 years. That's just true. So the question is not, are we building more houses and we're going to get more kids? The question is, are we attractive enough a community for people to buy new houses or to buy existing housing stock? As people who had families leave, do they get replaced by families, buyers with school-age children or not? That's going to be the predictor. So Kelly's right. The purchase and sales agreements of any type of housing stock are more important than the number of new building permits that are issued. So keeping an eye on it is vitally important, but we have to keep a eye on the whole housing market, not just new housing starts.
Oh, no, I understand that. I'm just saying there are quite a few new developments that have come in and that are planning on coming in. And I just,
But that won't necessarily translate to growth
oh,
enrollment.
I know. I'm just
won't.
wondering if we work with the planning board. My question is, are we keeping an eye on it? And he did answer the question.
Yeah.
I'm glad you asked that question, Timlin, because I mean, there are so many moving targets when it comes to enrollment, but as a general statement, in most communities, residential enrollment is decreasing every year. I mean, the number of students in Massachusetts public schools is decreasing every year.
And I'll also offer one more observation that I've seen over my tenure is Littleton is uniquely positioned. We are in a highly competitive market for primary and secondary education, primarily secondary education. We've got Neshoba Tech, we've got Parker, we have kids that go to advanced math and science, we have kids that go to Innovation Academy. So there's 3 charter schools that we are a sending community to. And then there are Catholic schools around here that people choose to send their kids to. And then there are private schools, prep schools. So that transition from 6 to 7 and 8 to 9 is always significant. So, Kelly used a sort of a what if a minute ago. Like, let's just assume everything is static, and that's fine, to look at it, but it's not. Our enrollment of children who live in Littleton attritions over time. It's inevitable. It's expected. It's fine. But we need to keep an eye on that too, and put all of that together into an equation that helps us model and predict where we're at. And as I look at these projected totals, we've got several classes over 130, but we also have classes under 120, right? And I think that's where we're going to be. We're going to be between 115 and 135 a lot of the time, but I don't really see us being above 140. If we were going to get there, we probably already would have. But the demographic trend is going to cap that out in large part.
That's a great point. And please remember, as you go up each successive grade, the chances of filling those seats we're recommending are not as great. So when we look at our high school, we don't have very many families that move in with high school students, or more correctly, I guess a better way would be that it's harder to have high school students choose another school. Once they hit high school, they usually want to stay where they are. But we do have some exceptions, and to not open these seats up would be somewhat of a disservice, because if we do have people that are looking, it allows us to stabilize our enrollment a bit, bring in some revenue, which is very important also. And the more we can stabilize our enrollment, the better off we are in terms of keeping teachers within their grade levels. When I first came to Littleton, we did not have that many school choice seats at that time, and I don't know if it was relatively new, but it just wasn't happening. But I remember moving elementary teachers to different grade levels because of the disparity in the number of students in each grade, which we would prefer not to do. That's, sometimes you have to, but we haven't had to do that for 7 years or 8 years. So I guess there's so many things that go into this, and I just want to make sure that, well, most of you are pretty new to this, that we're not anticipating by any means that those seats from grade even 3 up are going to be filled, all of them.
Kelly, quick question.
Yep.
It helps me to go school by school. I apologize, but I'm totally on board with the Shaker Lane talk now. So let's move to Russell Street. So we're advertising sort of 5 additional seats, grades 3 through 5. To me, this tells me that we're sort of shooting for an enrollment of around 120 per grade, and we're acknowledging that 137 is an outlier with grade 4.
Right.
Is that an accurate statement?
Really, if I would say between 120 and 130 would be ideal, but you don't want to create too much risk. If that happens, if we get to 130, that's fine. I mean, even at if we have a class at 130, and I know it's not static, but by the time that class went into grade 9, it would be 110.
Because of the fall off, you're saying.
Right.
Yeah.
So there's a number of factors that go into this, and we do everything we can to make sure that our high school has enough students so that we can offer the diverse programming that a high school needs to be successful.
But you're thinking that of the 5 advertised seats for grades 3 and 5, that we might not even be able to fill those?
Most likely not. We may
Okay.
get 1 or 2 grade 3, maybe no seats in grade 5.
All right. And then the storyline kind of sort of continues through the middle school and high school. I just kind of wanted to get a firm understanding of what we were looking at to sort of fill a grade level. We don't want more students and create sort of an overcrowding situation, but we certainly don't want to have underutilized class space and see that as a potential missed opportunity if we had students sort of vying to get into the district. But it all makes sense to me now.
Well, great. You need to be aware that if our enrollment slides too much, we lay off staff. We can't afford to keep staff. And that has considerable ramifications in terms of program offerings, et cetera, especially at the high school. So again, I think we've done a real good job balancing this. We're always going to have bubbles. And right now we only have 2. Which is good, and as I said, they're going to slide off most likely as we hit middle school and have those students go through middle school. Justin, would you like me to go through the middle school as well?
No, to me it looks like sort of the middle school is the same situation as Russell Street, and then we sort of touched upon the high school. So I'm good. I just sort of hearing the story about how students move through the program and making sure that we don't overcommit or trying our best not to undercommit. I get it. I just wanted to hear it. Thank you.
Sure. Go ahead, Brad.
Yeah, just a couple of things. One is I think the fact that so many students want to come to our district is a compliment to our teachers and our leadership. So thank you for that. The second is I just note that having the money that these students generated for our district was really helpful for the last year. And I appreciate the stewardship that you and the other school committees have provided. And third, I don't know if it's time, Mike, but I'm ready to move to support the administration's the proposed school choice seat plan.
Second.
All right, that motion's been made and seconded. Is there any further discussion on it? Steve, can you just pull the slide down so I can see everybody? I think I can almost see everybody. No, I think we're good with the slides. I mean, like, just get rid of them. Sorry.
Oh, get rid of them.
Take them, literally take them down. There we go. Thank
Sorry,
you.
misunderstood.
Thank you. All right, so is there any further discussion on that? All right, I appreciate the questions that we did get. It helps for us to take a good look at it year over year and remind ourselves what the goal is and where the balances are. And I appreciate Kelly's representation of how we're striving to make sure that we're being efficient in the use of our resources, but at the same time not backing ourselves into a corner with unexpected results. I think it's better to err on the side of saying to ourselves, oh, we could have fit a few more kids in a grade, and just living with that outcome than saying, ooh, we're a little tighter than we wanted to be. So trying to find that balance can be tricky, but I think we've done a good job year over year. And Brad is right. The money that we got is to serve us well through some very difficult budgeting years, and it's put us where we are. We've been able to facilitate some staffing by the use of school choice funds and gotten a staff member in a year or two earlier than we otherwise would have been able to take advantage of having that. So I appreciate everybody's support of the school choice program. Given that there's no further discussion, I will go through a roll call vote. Timmerman?
Timmerman Rassius, yes.
Matt?
Matt Hunt, yes.
Brad?
Brad Austin, yes.
Justin?
Justin McCarthy, yes.
All right, and Mike Fontella votes yes as well. All right, thank you, Dr. Clenchey.
And Mike, I do have one more slide that
Yep, good.
particularly show. Steve, if you could put that last slide up, that would be great. Always nice to show data with other people rather than just keeping it inside central office. So we started to do this a number of years ago, and it's kind of interesting. You know, I always have somebody ask me these questions from year to year, but so during the 2020-2021 school year, we have 56 Littleton residents attending Parker Charter School. You can see how many students in each grade level are attending Parker. And Neshoba Valley Tech High School, we have 36 Littleton residents attending Neshoba Valley Technical High School. So it's always nice to have an idea of the number of students that are seeking opportunities to go to those two schools. As Mike and I have pointed out, they're great schools. We're very fortunate to live in the area that we live in. There are a lot of great choices for schools. So Neshoba Tech provides you know, the opportunity for some of our students to venture out into courses that high schools in this day and age could not offer unless they retain to be a full service high school, and that doesn't include very many in the state of Massachusetts or beyond.
All right.
Kelly, do you think that's a trend with the tech school? That, you know, year over year over year, it looks like that number is trending up.
Yeah, it is. If I go back, I still, you know, maybe our applications are increasing a bit, but some students after they apply decide they don't want to go. So we're still functioning, you know, more or less between the 8 and 10 range. And so it'll be interesting to see what happens in the next 4 or 5 years in terms of that. I mean, we all know that some of the courses that Neshoba Tech offers certainly are a good option for students because the trades or some of the other professions that students could move into after they finish at Neshoba are in high demand. So it'll be interesting to see. I mean, I have theories about how we could restructure technical education, but I'll keep them to myself.
Yeah, well, I mean, I would offer that it might be a good idea for the next school committee to maybe get a presentation from Neshoba Valley Tech on, you know, exactly what they're offering these days, because as I read some stuff about the tech education, it's evolving as are, you know, non-tech schools as well. But there is definitely more students may very well choose the tech route than you would have traditionally thought, because it's not just about the trades. And I think we define trades at, you know, plumbing, carpentry, electricity, automotive repair, things like that. But there are a lot more offerings now where a student may say, I'm going to the Neshoba Valley Tech and fully expecting to go into a 4-year degree program in college, but I want exposure to robotics or computer science or CAD CAM or whatever it is that they can get there that they can't get in, you know, a school like Littleton or a school system like Littleton's public high school. And Kelly's right. There may be an evolution towards a blended look where a student is either a tech student, a Littleton high school student, or a combination student. There's a long way to go to get to that vision, but and you can see it too with the way community colleges are evolving and more students choosing a different route than saying, I'm going to go 4 years to a 4-year degree program. I might do 2 years at a community college and then matriculate up to the 4-year degree program or something like that. So a lot's going on. Landscape could definitely keep evolving and changing. It'll be interesting to see. And then, long way to make my point, Justin, then that would indicate why those numbers are trending upward, right? Because we're asking them to, we're offering that opportunity and pushing it because we think that's the way to serve a certain section of our student body the best.
Well, in some ways, Mike, sorry to interrupt. It's a reflection of the same dynamic that's bringing students into Littleton. Is they're offering something that's really attractive,
right?
Recognize the value of that type of education. It's great our students have those choices. It's great to have the option to go to Parker. I'm really happy with these relationships.
Yeah, definitely. All right, great. All right, thank you, Dr. Clenchey. All right, we are now at the second section of the meeting for input from interested citizens. If anybody's got their hand up, I see at least one.
Yes, we have one. John Kay, please state your name, your street, and your question, please.
Hey, it's John Kurzwick, 171 Hartwell Avenue. Hey, with all the discussion about the changes in the mask rules from CDC, we were talking about it at the dinner table with the kids tonight. And so I was wondering, has there been any change in the policy for mask breaks? Both my kids go to Russell Street. So I was wondering if somebody could give an update on what the mask break policy is at Russell Street.
Cheryl, you want to weigh in on that one?
Sure. Same as it has always been. So the kids have an opportunity to ask for a mask break if they need one before it's scheduled. We have chairs outside, and we also under the roof area. So even if on a rainy day like today, kids can go outside for a break. They have a built-in mask break for snack time in the morning. And they also have their mask off at lunchtime, obviously, while they're eating. And we only ask that while they're inside, if they have lunch inside, that they put their mask back on until after they're done eating, while they're in the classroom. And they can have their mask off the entire time when they're outside eating lunch.
Okay. Can I ask that we take a look at expanding the mask breaks for outside during recess? I'm just looking at the fact that, our own screening data is showing that there's very little in school incident rate of COVID. We have a high proportion of the towns vaccinated now, and it looks like we're up to 80% vaccinated for those that are in the most vulnerable group. And also, the EU CDC since December they've allowed kids under 12, their recommendation has been no mask in school. So I was hoping that, we could take a look at it. You don't have to give me an answer right now, but can we put this on the agenda for, taking a look at trying to expand the mask break while we're outside at least?
Good point, John. I think that it would be worthwhile so we've had our elementary school kids and middle school kids back this is the 4th week, Dr. Clenchey, with a break in between.
Yes. Yep.
And this is our 2nd week with our high school students back. They were back for a week and then we had the April break. So John, I think your point is valid in terms of as we accumulate more experience and more data from those experiences, I think we can definitely think about, what we can do. And obviously we're all hopeful that with the advent of spring, getting the kids outdoors more often, incorporated into the school day, like they're actually in class, but they get to go outside to do it. I think is an opportunity for us to reevaluate and create some opportunities for getting them closer to normal. So thank you for that. We will ask the administration to continue to work towards that.
If I could just add one other piece, Chairman, the outside of Russell Street, for example, everything that we have is set at 6 feet. So the chairs for lunches, when we're outside, everything's set at 6 feet. So as Katrina was indicating before, The more of those things you can do, the better. So everything is set at 6 feet of distance. So when kids are outside, we know for sure if they're sitting in a chair, they're 6 feet apart. I'll be honest that it's difficult with third, fourth, and fifth graders to have them maintain that distance when they go to play at recess time. So that's why we've been less, more wanting to keep with the mask policy during recess time. I'm sure the kids would love to have their masks off during recess, but that's kind of a stressful time for the recess monitors and to really, be able to keep the kids at 6 feet of distance. And that's why we've stayed with it at this point versus while they're in the chairs for lunch.
Okay, yeah, I mean, if you can, like I said, don't need an answer right now, but if we can start moving in that direction where we can give the kids a little bit more freedom in that front, I think it would be helpful, and I think it's safe to do it as well. So anyways, I appreciate the time.
All right, thank you, John. Anybody else? Any other public input?
No more questions.
Timlin?
I just would like, I'm wondering if Dr. Harrington could give an update. There was a lot of talk about senior prom, and now the senior class is able to have a senior prom. I mean, I can talk about it, or Dr. Harrington can, saying I have a senior, but with a daughter that is not very extroverted and doesn't do a lot, she was very thankful that the kids can actually have a celebration this year. I don't know if Dr. Harrington wants to
Yeah,
talk.
glad to be able to share tonight that we will be having the prom next Friday, May 7th, at the Colonial Hotel in Gardner. We were a little concerned about whether we'd have enough students register for it because it was sort of a fast turnaround, but they came through, and so we're able to do that. Appreciate all the chaperones who are making themselves available on relatively short notice to pull it off. Should be a fun night for the kids. Memorable, special, certainly in these times. We are joined by 2 other schools in our area who will also be hosting proms there over the next month. So that provided a little reassurance to us that they had protocols in place. I talked to or had email communication with a couple of principals who are also hosting there and in other nearby hotels. So we were able to make sure that we have protocols in place that, the hotel has to abide by with the Gardner Board of Health. Of course, anytime there's an event like this right now, especially in the midst of the pandemic, there's always a little bit of apprehension about, how will the kids abide by the rules. Cheryl pointed that out. Sometimes it's challenging at different ages, and certainly there'll be a lot of excitement in the air that evening. But these kids have, as Timlin, you and I have talked to the PTA and as a parent over the course of the past year, this has been a very challenging time, particularly for this year's seniors. They've been going through a year of this, and they're ready for it and looking forward to a fun night. So it will have a modified but traditional prom with dancing. That is allowed by the state and the Board of Health in Gardner for that hotel. So we're grateful for this opportunity. And it took a fair amount of work over the break to make this happen, turn around really quickly. So shout out and thank you to Meredith Perry and the class officers who worked on this and all the staff involved behind the scenes, sports staff in particular. So, looking forward to it and keeping our fingers crossed for a nice, safe event.
Thank you. And then just one other thing, Mike, as far as the seniors, my involvement with PTA, last year I did senior spotlights for the kids on Facebook where parents sent pictures and we just highlighted them on different Facebook pages just to let parents know if they haven't heard. We are doing that again. We want to make it a yearly tradition, the PTA. So we're going to do it again starting Saturday, May 1st. I've already gotten a bunch of emails, but we're trying to make this a tradition in town to put it out.
All right, great. Yeah, obviously, we'll talk about graduation will be coming up as well. But we wish we could do more, but it sounds like we're going to be able to do at least something. I think we've been, on a relative basis, pretty fortunate. We've had our sports seasons. We're going to have prom. We're going to have an in-person graduation in all likelihood. It's not going to be exactly what we want for the kids, but it's better than we were maybe hoping for at certain points in the year. And we just got to, continue to feel fortunate when we can and do the best we can. Brad?
Just to Timlin's point, the more we as a town can put positive things on Facebook, the better. So I appreciate what y'all are doing that. Been a tough couple days.
All right. All right. I don't think we're done with public input. We'll quickly go through subcommittee reports. PNBC, do we have anything to talk about?
Nope, no updates.
Okay. All right. Budget subcommittee. I saw are we trying to have a budget subcommittee meeting for a reason? No?
We rescheduled that for next couple of weeks. We'll get back together at some point. We'll post notice.
All right, very good. How about policy? Anything we need to think about policy? Okay.
Nothing
All right.
else.
How about CPAC, Brad?
Yeah, I've got some announcements, Mike. We had a really productive meeting this last week. We're going to have a virtual workshop next Tuesday night on May 4th from 7 to 9. It's by Leslie, who is the MassPAC director for the Federation for Children with Special Needs. Really helpful workshop for parents on basic rights and transition planning process. We have our school liaisons, and they're going to be reaching out to the principals, if they haven't already, to talk to you about how we can better function at a school level as a CPAC, and then how we can better communicate with parents who are new to the CPAC process, how we as a group can coordinate with them. And along those lines, we're going to we haven't done a survey for a while, so we'll probably do a survey and try to get a sense of more parents and what they need. The other thing, speaking of Facebook, is that CPAC is a public body, and the Facebook page needs to be an open page, not closed. But we're also there. There was a vote, and we approved. We're going to form like a Littleton Friends of CPAC or Parents of Special Needs thing. That's not in a CPAC thing, but where parents can talk to each other more candidly about and support each other. We think that's one of the big goals of CPAC, and we think that would be an effective way to do it. To keep an open page that everybody has access to, but also have another place. It's more of a forum. And then the annual meeting for the year will be on June 15th of this year. So it's a really exciting group. We had a really engaged group of liaisons and leaders there. So I'm really happy with how things are going.
All right, great. Thank you. All right, anything else? Okay, we do require an executive session tonight for the purpose of contract negotiations. I will say that after we adjourn from open session into executive session, I'm gonna need about 15 or 20 minutes before I'll be in the executive meeting. So bear with me. But at this point, I will entertain a motion to adjourn from open session into executive session with no intention to return to open session for the purposes of contract negotiation discussions.
So moved.
Moved.
Second.
All right, motion made and seconded. This will be a roll call vote. Timlin?
Timlin Rassius, yes.
Brad?
Brad Austin, yes.
Justin?
Justin McCarthy, yes.
Matt?
Matt Hun, yes.
And Mike Fontella Welch, yes, as well. Thank you, LCTV, Judy and Dave, and thank you to Bettina and Dorothy for facilitating our meeting. We'll see you guys next week.
We say 8:45 then executive session?
Yeah, 8:45 will be good, yeah.
All right, see y'all. Thanks, guys.
Thanks.
Night.
Night.